The intensive care hospital at the Klinik Bavaria Kreischa near Dresden is one of the largest facilities for patients who require long-term ventilation and support in weaning off the respirator. It is a specialised hospital for the chronically and critically ill. The number of chronically and critically ill patients is growing rapidly due to developments in medicine and technical advances, which are constantly increasing the survival rate of seriously ill patients. At the intensive care hospital in Kreischa, all the necessary options are available to best treat chronically and critically ill patients. Worldwide, there are just a few clinics which offer the same capacity of respiratory places. Chronic and critical illness is a phenomenon which arises after intensive care therapy. Due to a patient's illness or the after effects of their illness, the patient remains dependent on life support technology. For example, it can mean dependence on artificial respiration or dependence on a dialysis machine. Therefore, patients still require treatment in an intensive care unit. One of these patients was Harald Graul. The 65-year-old fell off a ladder in 2004. He suffered serious third-degree concussion and a multiple vertebral body fracture. He was taken to an emergency hospital in Halle, where his cranium had to be removed. Titanium plates strengthened his spinal column, giving him a chance of survival. Harald Graul was observed around the clock in the intensive care unit and was dependent on life support technology and required constant care. He was in a chronic and critical situation. Days and weeks passed. Harald Graul was transferred to the intensive care unit of the Klinik Bavaria Kreischa, which specialises particularly in the further treatment of the chronically and critically ill. Early therapeutic measures can not only extend life, but also give back independence. In the hospital, I was placed in an artificial coma and given artificial respiration. It was possible to help Harald Graul. It is just like escaping from a world dominated by a loss of speech and a loss of breath. The task of the intensive care unit in primary care is the treatment of serious acute illness, for example, following an operation or after suffering from pneumonia. It's about saving and maintaining the patient's life. Serious acute illness can result in after effects and complications. It is essential to treat these complications here in our intensive care unit and to improve the function of the patient. These after effects can include, for example, long-term dependence on a respirator. It's our job to minimize or even end this dependence so the patient can once again breathe completely independently. Naturally, this is not always possible. For some patients, long-term respiration also needs to be carried out at home or in a care facility. The Klinik Bavaria specializes in the long-term treatment and rehabilitation of the seriously ill. In our intensive care unit, the aim is to wean patients off technical equipment and ending the need for respiration. Harald Graul was unable to breathe by himself in the beginning, but the intensive care therapy was soon successful. Around 2 weeks after I had been admitted, they were able to end artificial respiration.
My husband learned to swallow, speak, walk, and even sit by himself again. All of the things he hadn't been able to do on his own.
To begin with, it was a learning process. First of all, I had to learn how to cope with it, but then it somehow worked out in the end. acute illness can often result in damage to the kidneys. This is why 15 to 20% of the chronically and critically ill patients who are admitted to the Klinik Bavaria require dialysis treatment. Wounds are also a problem for the chronically and critically ill. These complications usually occur after more serious operative procedures or following injury. Therefore, the treatment of wounds in the clinic's intensive care unit is an important area of activity. Multi-resistant bacteria are also a frequent problem for the chronically and critically ill. It is essential to have procedures in place in order to protect patients from these bacteria. Not only the patient who has the bacteria, but also the other patients. Nevertheless, it is just as important to avoid isolating these patients or stigmatizing them, because life goes on. Of course, the clinic has all the necessary medical diagnostic procedures at its disposal, which are essential for the treatment of the chronically and critically ill. For example, this includes an endoscopy and an ultrasound examination of the heart, which is carried out via the esophagus. The CT-assisted PEG enables feeding tubes to be passed through the abdominal wall into the stomach with the aid of an endoscope, which ensure the artificial feeding of the patient. Lying down for long periods of time causes regular muscle wastage and general weakness in chronically and critically ill patients. Therefore, it is important to regularly train the patient's muscles in order to strengthen the entire muscular system. Walking therapy is an effective form of treatment. Standing upright strengthens the pulmonary function so that seriously ill patients can soon breathe independently again.
Pause. Pause. Hinsetzen oder im Stehen? Im Stehen.
Walking therapy also contributed to the success in the treatment of Harald Grau. He spent many hours training in order to recover bodily and pulmonary function. I had to learn to walk again with the help of the therapists, who gave me a great deal of support. However, doctors, therapists and nurses are not always so successful. For a small number of patients, they are unable, despite all of their skills and technical support, to help them return back to their old life. For some patients, the illness is so serious that it is not possible to preserve life. In these situations, appropriate, suitable medical and care treatment must be guaranteed. This is known as palliative treatment, which is unavoidable in such serious illnesses. It is also important to face the problem head-on. Palliative care is a holistic concept. It involves the relief of symptoms, the reduction of the accompanying symptoms of the illness, and caring for them until they die. It also includes the care of family members. The palliative team at the Klinik Bavaria consists of 18 active members. They look after and care for terminally ill patients.
I think that palliative care is very important. Dying is also part of the journey through life, and everyone should have the right to be accompanied on this journey, to be accompanied with dignity. Just as people have lived their lives, they should also be able to experience their last moments individually and in accordance with their wishes.
However, many patients do succeed in finding their way back to a normal life. This requires great effort. They must not give up on themselves. It requires the self-sacrificing effort of the family. And even for the staff, it is always a new challenge dealing with difficult events and making decisions, as well as coming to terms with them.
From experience, an illness is always a turning point in life. The more serious an illness is, the bigger the turning point, and the bigger the shock. The main challenge is to come to terms with it. It is difficult for patients, and sometimes even more difficult for the relatives and the staff. I see my main task as being there and providing support.
You must remember that it scares the patient to think about what they have to face and what they're experiencing. Therefore, it's important to give them the chance to say what's on their mind, particularly when they sometimes don't have the courage to tell their relatives because they don't want to become a burden. So they don't have anyone, apart from us, who they can talk to and who they can trust, where they can maybe even shout and where they can also complain about God and where they can express their anguish. Harold Graul owes his life to the medical and technical advances available for the chronically and critically ill. After 4 months, he was able to leave the clinic in good health. Yes, I now have a second birthday, which I lived to the full. That was a fresh start when I was able to go home, as I was discharged from here. Ultimately, that is the aim of the treatment of chronically and critically ill patients, giving them back their quality of life as far as possible, so they can once again live their lives at home or in a care home. Making this a reality is the special task of the Klinik Bavaria. This institution is a tribute to the rapid medical and technical progress which is taking place at the highly sensitive area of man, machine and medicine. The intensive care hospital has also assumed a small part of social responsibility. In the future, the demands will continue to grow due to medical advances.